Good afternoon, everyone. My name is Diane Callender, and I will be serving as your moderator today for our session on self-cannulation, moving from intimidation to empowerment. Very happy to be with you today. As you see on the screen, maybe from my name, that I am a licensed school social worker in the Commonwealth of Virginia. But I became so involved in this topic today because of my own personal experience with my husband, who is a renal cancer survivor of 7 years. We very casually found out through a routine examination that my husband had renal cancer some 7 years ago, which required a left nephrectomy. Following that nephrectomy, we found that there were many cancerous lesions in the right kidney that needed to be monitored. And so he was able to be dialysis free for 7 years up until 2022, when those tumors began to grow rapidly, and we suddenly found ourselves needing to have the other kidney removed and needing to be on dialysis. So now we are in the process of learning more information after being a year and a half on dialysis and having success with that, turning to other options for us. So I'm so excited that we're doing this topic today for many reasons, to educate not only myself but to others about self-cannulation and moving from intimidation to empowerment. So I'd like to introduce you now to our panelists for today. We have some exciting panelists that I want you to get to know, and they will give you their own individual stories as we begin. First, I'd like to introduce to you Dr. Bermudez. Dr. Bermudez is currently a clinical assistant professor of medicine of the Geisinger Commonwealth School of Medicine and associate program director of the Nephrology Fellowship. For the past 10 years, she has served as medical director of acute dialytic therapies and the home dialysis program. While in this role, she has been recognized for the significant growth and high quality of the program. So again, welcome, Dr. Bermudez. I'd also like to introduce you just briefly to the other panelists, and they are Andrew Gross, who is a 42-year-old born and raised in Selinsgrove, Pennsylvania. Andrew received a diagnosis of kidney failure back in 2020. He moved back home and was listed for dual organ for liver and kidney transplant list at Geisinger Medical Hospital and most recently at the Johns Hopkins Center. Andy began dialysis in 2021, which he did in center, and later switched to home dialysis. Thank you, Andy, for being with us today. We also have Rapa Yasharhala. Rapa is a certified dialysis technician and has been dialyzing for 22 years now. He has Alport syndrome, which he inherited from his mother. Rapa has done every dialysis modality, and now he dialyses as a home hemodialysis patient. Welcome, Rapa. And last but not least, I'd like to welcome Randy White. Randy resides in Sunbury, Pennsylvania with his wife and his youngest son. His journey with kidney disease started about 12 years ago. He has completed 1 year of in-center dialysis and now 1 year of home dialysis. So as we begin with our panelists for today, I will start with Dr. Bermudez. Dr. Bermudez, I have a question for you as we start off. As the medical provider of the panel, can you share with us your initial thoughts on self-cannulation, and did provider intimidation exist on your end?
Thank you, Diane, and thank you, American Kidney Fund, for this invitation. It's truly an honor. Self-cannulation has been instrumental to my practice and our unit's ability to empower so many patients to be able to do dialysis at home. I would be lying to you, Diane, if I tell you intimidation was not part of my practice in my beginning of my career as a home dialysis provider. Most of us have not had an experience to see self-cannulators during training. So when I took on the directorship of the units, we had a very steady, amazing home dialysis unit. All patients had care partners that were cannulating for them. It became very clear to me after a few years of practice that one of potentially the most important barrier for patients to be able to do home dialysis is fear of needles. So as a team, and this is what I say, that it's an honor for me to be here today, to be the voice of my team, the facility administrator, the nurses, and our patients that actually made self-cannulation possible. So it just became an organic thing to do. We started to just identify we needed to do better for our patients. And, we came up with the idea as a team, and very quickly after that, it was made a reality. I am speaking for my unit, but I know we have such amazing nurses all around the country. They're expert cannulators. So learning the process of teaching our patients seemed to be also organic. There's a lot of resources. They reached out to units that were doing it already, and we initiated the process of self-cannulation. It immediately allowed us to help many patients to go from in-center to home and remain home and be very successful at doing it in the comfort of home.
Thank you, Dr. Bermudez. I really appreciate that. I particularly was taken by how you explained how education is part of it, making sure that your patients as well as their home care partner are knowledgeable and a part of that process. And just navigating that whole process is quite an experience for the patient, the provider, and the care partners. From your experience as a provider, what do you think is probably the most important or the most caring topic that comes up to you from your patients or their care partners?
I think is the fear, of the needles, is the fear of doing something wrong. So I think, and this, I come now with experience and honestly with the peace of mind to tell everyone that is listening today that patients, when they do the needles themselves, they do amazing. They become experts. We're going to talk a little bit more during my presentation, and later we'll hear from our patients that, once you do it yourself, no one is going to know your vessels, your veins better than your own self. So that really has been empowering to all of us.
Thank you, Dr. Bermudez. I'm excited now to see your presentation. Thank you.
Very good. So what is self-cannulation? I know many may take that term as a new term. So it's basically when the patient inserts his or her own dialysis needles. Next slide. So the objectives of my talk, I'd like to discuss the major benefits of self-cannulation. We are going to discuss what is important for successful self-cannulation, and we're going to go over the process and some key takeaways. So what are the benefits of placing your own needles? I think the most important one is the ability to increase confidence, and it gives you control. As I briefly mentioned before, is associated with fewer missed sticks, infiltrations, and hematomas. What these two terms are is basically when the needle actually crosses the wall of the vessel and there's some bleeding outside the blood vessel. So when the patient places its own needles, you are actually feeling both sides of the needle, and it's less likely you're going to miss the path where the needle should be going towards. This has been associated to the ability to limit or minimize the risk of complications, and in many situations, the access can last actually longer. Believe it or not, our patients tell us that it's less painful and it's less, it causes less anxiety where they're able to put their own needles. And I will share with you that my patients that self-cannulate, once they become proficient, they really don't want anyone to do the needles ever again. It truly can empower you to go home and take the next step to potentially do dialysis at home. The next slide. So how do I know if self-cannulation is right for me? So there's some steps that we could start taking at the very beginning of this thought process. If you think you're able to grasp or hold the fistula needle with the hand opposite to your vascular access, If you can reach your vascular access with your hand while holding the needle. Can you reach both the red and the blue needle locations? Can you hold your own needle sites after dialysis? So in the next slide, we're going to talk also about what is important for self-cannulation. Can I actually do it? So if you realize that you do have the desire to learn the process, you do require good sensation in your fingers. Good personal hygiene is key, and this is to prevent the potential risk of infection of your access. Your team is going to teach you all the steps that you're going to be taking at home in order to prevent this. Good eyesight is also important, so you actually don't miss the location of the needles. Here we have actually the picture of one of my patients that very kindly agreed that I shared her story. You can see here that she uses a device that utilizes a headlamp and also some lenses that increases the vision yield. So Megan is in her 30s. She started dialysis in center via a fistula, which actually is located in her dominant arm. She's a young mother of a beautiful girl, so she is a caregiver herself, and she also has a full-time job. So it was really hard for her to have to go in center. She was very hesitant with the thought about doing home hemodialysis. Her mother, who is an amazing caregiver and care partner, was very fearful of doing the needles for her. So that was the major barrier for Megan to be able to go home. But on top of it, she had a little visual impairment. And also, as I mentioned, her fistula is in the dominant arm. So that would imply that she needed to cannulate with the non-dominant arm. So here is where I give a shout out to the team and where I reinforce that it truly takes a village. So the in-center nurses felt so motivated to help Megan go home that they came up with a lot of strategies to overcome the barriers that we identified. They found these goggles online. They truly made a difference. We decided to help Meg choose a technique of cannulation called buttonhole cannulation, which I'm going to explain how it is, that allows for predictable pathway and utilizes the same site that helped her cannulate with the non-dominant arm. Megan has been self-cannulated now for almost 2 years at home. She continues to work full-time, care for her daughter, and she has had no infiltrations or hematomas since she started to self-cannulate. So with this, I just wanted to reinforce that all of these things are very important for the safety of you placing your own needles, but try to continue to work with your team and have your team be willing to look for strategies to overcome potential barriers. Next slide. So if you think that self-cannulation might be a good choice for you, there's few steps that you can start taking to start becoming a little more comfortable with the needles. So you can start by watching someone else put in their own needles and then watch your own. You can hold your sides at the end of treatment. Also ask the staff allowing you to hold the needle. Then use how the needle feels in your hand. You can start thinking about maybe applying a topical cream or anesthetic that some patients like to use to minimize pain. That being said, I'll be eager to hear from our patients. Most of my patients eventually tell me that they do no longer require these creams because cannulation becomes less and less painful over time, especially so when they're the ones doing it themselves. And of course, ask for more information to your staff, to your nurses, technicians, physicians. Next slide. Start learning about your access. I would empower everyone to do this regardless whether you're ready to take self-cannulation or not. You want to learn how the appearance of your fistula should be. That's called inspection. You can start learning how to listen to it. So you can actually hear what we call the bruit. Your nurses can actually provide you with a stethoscope that you can take home so you can examine your access on the non-dialysis days. Learn to palpate, what we call a thrill, is that vibration that is felt on the fistula. The more you palpate it, and once you get used to do it every day, you will be able to recognize if something doesn't appear to be right with your access. Start learning how to clean it properly. Do so before going to your in-center treatments. Ask your nurses to help you how to utilize the aseptic solutions that they use in center. And last but not least, ask about the actual needle direction and the anatomy of your fistula. Your nurses are able to provide even pictures from your surgery time where you can really learn the location of your fistula, the length, and really become familiar with what we call your lifeline. Next slide. So what are the types of accesses? So here we have, in order of preference, the three main type of accesses. So we have the AV fistula. It is considered what we call the gold standard. That means that is the preferred access for patients that are able to have one. Not everyone has suitable veins to be able to have what we call a mature fistula, but if you do, that is strongly what we recommend you choose as your long-term access. So what it is that the surgeon is going to join your vein and your artery. You want to have this access placed months before you need dialysis. And it is preferred because it doesn't utilize any artificial material, so it has a very low risk of infection. We know that patients do better, they have less admissions, less infections, less hospitalizations. If a fistula is not possible, because as I mentioned, the veins are not suitable, the surgeon can place what we call a graft. And a graft is similar to a fistula, but we're going to be utilizing a soft tubing or artificial material that is going to join the vein and the artery. It's equally a very good access, but it does have an increased risk of infection because there is a foreign material within your blood vessels. Last but not least, we have the dialysis catheter. This access is an access that most patients might need at some point in their kidney journey, whether they need it before their fistula is ready to be used, or sometimes if the patient cannot get a mature fistula or a graft, then they might just need to utilize a catheter. This is a soft tube that, as you can see, is connected into a major vein and is going to be directed into the right side of the heart. Next slide. So there are two types of cannulations, two methods of cannulation. The most common one and standard method of cannulation, especially what we do in center, is called robe ladder. What this method is that the needles are going to be placed in different sites each treatment. We are going to be rotating the needle each dialysis treatment. This allows for each site to heal completely before it is utilized again. It's a very good method, especially for fistulas that have enough length. In this picture, we see a very long, nice 13-centimeter fistula that will allow you to rotate over several treatments and keep the sufficient space between the two needles. It utilizes sharp needles, and infections are rare with this technique. If you happen to have a graft, this is the only method you should be utilizing. Next slide. So the second method is called buttonhole technique or constant site technique. This is intended for home dialysis and ideally for just one cannulator per fistula, ideally yourself. The way this works, as you can see in the picture, it looks like two buttonholes or like ears that are pierced. So initially, the cannulator, who's really going to be owning that fistula, is going to be inserting the same sharp needles, following the same direction, depth, and angle every time. And you're going to do that for at least 8 to 10 times. After that, a fibrous tract is going to be formed, again, like a ear that is pierced. And after that, the patient is able to advance blunt needles, as you can see, is robe. It allows for less trauma to the skin and the vessel, and it goes down this path. Our patients, for the most part, tell us that it causes less pain, less anxiety. The site of cannulation is more predictable because it's already formed. There is an increased risk of infection with this technique. There's not a lot of data in the home dialysis population, but we know and we have good studies telling us that if we follow proper technique cleaning the fistula, and again, if it is the same person following the same track of cannulation, patients do very, very well. There's some studies also showing that there's less risk of hematomas, infiltration, and in some studies, we've seen less formation of what we call aneurysms, which is dilatation of the blood vessel. You cannot utilize this technique if you have a graft. So again, if you have a fistula, you can use it, but not a graft. And it could be extremely helpful for patients that have very short fistulas or that are very hypertrophic or what we call tortuous. This sometimes could really allow us to utilize that fistula and not have to locate a catheter on the patient. Next slide. So another patient of mine was very generous and kind, and she wanted to share her story. Jess has been, her kidney journey started when she was a kid. She was born with a genetic kidney disease. She started with peritoneal dialysis as a baby. Then she had a transplant that lasted many, many years. Then after that, she had very tiny veins, so she had no choice but a dialysis catheter. And she actually was dialyzed in center for, I believe, 9 years. After 9 years, she decided she wanted to do home hemodialysis, and she has been doing so for almost 2 years. She does it by herself. She has a husband that is a wonderful support for her, but she's able to connect her own needles to the catheter, and she pretty much does everything independently. Jessie has been able to now work also full time. She enjoys vacation, and she has this beautiful hobby that I always admire and look forward to see that she gets to do while she dialyzes. She wanted to share with us that she loves doing dialysis at home and being able to be independent. So if you do have a catheter, I wanted to include, even though you're not placing needles, I think for the sake of what it means, you also could self-cannulate, and being able to do that by yourself could also allow you to do dialysis in the home setting. Next slide. There's different training strategies, and depending on your nurse educator, there's going to be they're going to tailor the teaching to your needs. This is one that is very common. It's called the tandem hand cannulation. As you can see, initially the nurse is going to be placing the needles, and the patient can put the hand on top of the nurse's hand, and then the hands are inverted until you're able to start cannulating with the direction of the nurse. Next slide. So, can you do it? Can my unit help me put my own needles? Is your right as a patient? Medicare and Medicaid policies state that patients have the right to know and participate in their care and treatment to the extent they desire. There is no any sort of policy or permission required by CMS. So any unit that feels has the capacity to learn this process and help you cannulate should be able to do so. It can be, as I mentioned, done in any facility. You can start learning in the in-center part, and then you can get empowered to go home. Next slide. So here are my key takeaways. I would encourage you to consider getting the courage to self-cannulate. Taking control means less pain, more independence, better outcomes. Although you could self-cannulate at the center, there's something called self-care. There are many patients that desire to continue to do dialysis in the center with the support of the nurses, but they want to take control of their therapies. They want to follow their vital signs, monitor themselves, put their own needles. That's something you should inquire if you think that's the right strategy for you. But do remember that it will open the door for you to potentially do home hemodialysis. We know that home dialysis can give you more freedom, better control of your blood pressure, less medications. It can improve energy and recovery time. Remember, you have the most to gain if needle placement goes well. No one will know your fistula better than yourself. And ask your team to talk to you about self-cannulation. And I think that's the end of my presentation. I have at the end some resources that I'm sure you'll have access to. These are great online resources for nurses, physicians, patients to learn more about the process of self-cannulation.
Dr. Bermudez, thank you. Thank you, Dr. Bermudez, so much for that enlightening and informative presentation. I know as a care partner, I certainly feel a lot more comfortable with exploring self-cannulation, and I just appreciate all that you shared with me today and with our team participants. As a question from our Q&A that I have for you today, I wanted to know, or a question that was presented, is self-cannulation a requirement for home dialysis?
It is not. Many patients prefer to have a care partner that inserts their needles, and that's also a great strategy. You do have to either place your own needles or have your care partner do so for yourself. I would say that over as you mentioned, the past 10 years of my opportunity to care for patients on home dialysis, I realized that it really empowers the patient to continue to be home. Is really discouraging when the care partner who is the cannulator can no longer be a care partner, to have to go back in center when the patients have been thriving at home. So I will share with you that I'm trying to motivate my patients to take the needles on their own hands. I have patients that have been doing home hemodialysis for more than 6 years with their care partners doing a great job. So it's hard to, want to change that for my patients, but it's something I talk about every clinic. I'm like asking, are you ready now? This would be great. I think it also is good to take that task on your own hands. Care partners are amazing; they're angels. They do so much for our patients. So I feel that sharing that responsibility um, could be very good for the family. For everyone, for the team.
Okay, thank you so much. I want to again thank you for that wonderful presentation, and I want to invite our panelists that are with us to start to chime in this and sharing their experience as well. As I mentioned, everyone, this is a session that is focused on self-cannulation journeys of patients and will serve as a where to and how to share to move from seeing it as an intimidating process to feeling more and more empowered to self-cannulate for home dialysis. So at this time, I want to invite some of our panelists to join us. I want to start with Rafa. Rafa, hello again to you, and thank you so much for being with us today. Rafa, I noticed in your bio that you mentioned being a second generation end-stage renal disease patient. Can you share a little bit about your home dialysis journey and how you made the decision to do home dialysis, please, Rafa?
Yes. Well, at 13, uh, I started undergoing kidney failure from alpha syndrome, and I ended up inheriting that from my mother. She was transplanted at the time. I lost my kidney function, so we started off PD, and I learned how to do that all on my own. You know, she's basically forced me to. She let me know that she wasn't going to be here forever. So that was my first home experience with the PD. Shortly after that, I got transplanted, and I lost that transplant, and then I ended up on chemo. Uh, so going on for like the next semi-odd years, 'cause it's been a long like 20 something years now. It wasn't until probably about a year and a half ago when I started thinking about home hemo, like during COVID, because I didn't have any care partner. I didn't have the luxury of doing home dialysis. So once I got married, I was able to have a care partner, and then I was able to set up things for myself here at home. And
So a
that's
care
pretty much
partner
how
was
that.
essential. Oh, I'm sorry. Go ahead. Continue.
That's pretty much how that worked out. I mean, I could have probably done it on my own, but I just uh, I feel like somebody should be there personally, because I am a dialysis technician. So, my mind immediately goes to alarms, troubleshooting problems. So, I know of other people who are uh, singular home dialysis patients, and then they do awesome, but they have their blunders. Uh, and those are the blunders that I would like to avoid. So having a care partner was ideal for me, very ideal for me. And that's what I've been doing for home.
So, Robert, you mentioned your mom and your experience with her. Do you feel that being a second generation end stage renal disease patient had a major impact on your initial thoughts about home dialysis or
Uh, yes.
not?
Well, because when I first came, well, after my mother passed away, uh, I had moved away, and
Mhm.
everybody was trying to get me into home dialysis. But again, I had no care partner, so it wasn't even in my mind. I was young, I was trying to work, do stuff, and do things and be places. Uh, but it wasn't until I got older I started thinking to myself like, I gotta get out because the
Okay.
unit isn't really ideal for most people, especially after COVID. Like once COVID hit, a lot of people were trying to scramble to either get into PD or get into home hemo because it was travel everywhere. So now things are a lot more comfortable for me as far as like doing dialysis. Mm, I noticed my blood pressure's gone down a lot, anxiety down, everything down. So being in the
Wow.
comfort of your own home is just
Yes.
you're not looking around. You're trying to can't really lay back because you hear an alarm and then it's just like you realize it's not yours. Uh, and then people are people. People make mistakes. So you have technicians. Uh, some are good, some are bad, and you don't want those mistakes happening to you. Kind of like what Dr. Bermudez was mentioning. You know, there's less risk. There's less risk involved when you're doing it yourself. Because, for me, I have a loop graft. I have a loop graft. And you've seen it in the
Hmm.
picture, and that's in my leg. So I'm freehand. I can cannulate with both hands. So when I go in for my venous, this hand go in. When I go in for my arterial, this hand, boom, or I go up. So it's either up or down for my arterial, and then I have just a full view of what it is that I'm doing.
Okay.
Uh, but that barrier of overcoming it, like, can I
Mhm.
do it? Should I do it? Will I be able to do it to myself? Uh, it hit me for a little bit, but then I was like, let's get it, let's do it, and it's been the best decision that I've made so far.
Thank you so much, Robert. Dr. Bermudez, I want you to sit tight because I've got the chat is blowing up with a lot of questions for you. But I want to bring in our other two panelists just to get their opportunity to share. So Randy and Andrew. Andy, can you share your journey to home dialysis? Give us some of your experiences and about the moment that made you decide that home dialysis was for you. And
Yeah,
we can start with either one of you. Andy.
yeah, I'll go first. It was scary. In 2020, I was going to aeronautical school in Myrtle Beach, and all of a sudden, I just started feeling weak in my core and everything. And one thing led to another. Through blood work, found out I was a lot sicker than I thought I was.
Wow.
And so I knew I didn't want to be in Myrtle Beach. My care team was in central Pennsylvania, where I grew up, and my mom pretty much made the decision for me, drove to Myrtle Beach and picked me up and drove me home. And so I did not get a fistula at first. I had a CVC and was put in center, and I had no clue about dialysis. I just thought there was one thing and one thing only. And it was sad in there. And as soon as I heard that there was something other than in center, like home hemo, where can I sign up? Unfortunately, the waiting list was pretty long because I wasn't the only one that wanted to do it. And my mother, she is no nurse. She's a retired teacher. She was willing to do this with me. And the only thing she can't do is watch me put my needles in. She can do everything else. She is the best nurse I've ever had, in my opinion, other than the ones I have at DaVita. But it was the fear of the unknown. I mean, going into everything. But I have the best nurses and doctors available. They guided me through everything. And once you get the technique down, the fear goes away. I'm still nervous to stick myself, but through preparation, this numbing cream right here, the lidocaine cream, I put that on for at least a half an hour before I insert my needles, and I use the blunts, and it does not hurt whatsoever. Wow. And you can feel it hitting your vessel wall, and you know when to lay off, and it doesn't hurt. And I guess I was more afraid of bleeding than anything instead of the needles. But now they just go right in, just right in smoothly. I get the flashback, get the blood, and off I go. And now recovery time from in-center was anywhere from 8 to 12 hours to where my body would recover and I could actually function like a normally, I guess. But now, right after dialysis, I can go mow the grass, go walk my dog, do anything. And my health, appetite, gained weight, everything has improved dramatically. And I'm not saying this to be cheesy, but Dr. B saved my life. She is one of the best doctors I've met. She cares about her patients and their input. She cares about what they have to say. And also a shout out to Tina Alexander. She is the best home nurse on the entire planet. I mean, she's not just a nurse, she's a friend. She makes house calls every once in a while. She calls you just in case, you know, you had a surgery that doesn't have anything to do with your kidneys. They'll call just to make sure you're okay. My journey through home hemo was scary, but everybody made it a lot more pleasurable and changed my life for the good.
All right. Thank you so much, Andy. Randy, could you tell us about your journey, please?
Yeah. So mine started back in 2012. I was perfectly healthy 1 minute, and the next minute I had pain in my lower legs. We went to the emergency room. From that point, we found out that I had an infection, which jumped into my bloodstream and attacked my kidneys. And my kidneys had shut down four separate times. And finally, we had some tests run and found out that my kidneys had scarred. And at that point, once your kidneys scar, they slowly start to die off. For me, at that point, it was almost like I didn't have any control over anything. You know, I was playing somebody else's game. They had the rules. They made it all up, and I was helpless in it. Once I started dialysis, I was in center. Andrew and I actually go to the same center, so we deal with the same people. And I was there for about a year when I saw another patient come in who was actually doing home treatment. And I watched him, you know, insert his own needles into his arm, and I'm like, I don't know, man. I don't know if I could get to that point. And the care team there, they were like, yeah, you can do it. It's not as hard. And they started training me. And I will say that after about the third or fourth time of inserting my own needles, I kind of got to the point where I didn't want other people doing it anymore. And I've told Dr. B this a few times already. There are a few people that I would even trust at this point to insert needles into my arm. My wife is she is my main care partner. However, there was somebody else that we did bring in on this, and I remember telling Dr. B that this, and she cringed at first. But my 14-year-old son also takes part in this. Yes. He helps set our machine up. He's been there to help me, take needles out, get medicine together. I've taken the time to train him step by step. He knows what he's doing. I trust him 1,000%. He knows that if there would be a problem, he knows exactly where to go, what to do, who to call, who to contact. You know, and you know, it's a total team effort here. You know, because there may be days, and it has happened, where my wife has gotten sick, and you know, she couldn't be there to help me out. So, you know, because we had trained our youngest son, we were actually able to still stay on task and, you know, do the things that needed to be done in treatment. And, you know, Andrew's right. We do have a great care team, Tina, Mo, Dr. B. I mean, just all of them. You know, they care so much about us. They call, they check in on us. And, you know, for me, I finally feel like I have control. I'm back in control of my life. I get to set my schedule. I get to do the things I want to do. You know, and Andrew's right. Right after treatment, hey, go walk the dog, go coach my baseball team,
Wow.
you know, go for a hike, do whatever we want to do. You know, it's there for us to do it now.
Amazing. Thank you all so much. This is just truly encouraging. And I keep hearing a common theme from all of you is how important your care team has been for you and that support from the doctors to the family, just amazing, and the educational part. Dr. B, we've got a few questions for you from the chat, if you don't mind. Panelists, there will be a few for you, so please sit tight. So, Dr. B, one of our questions is, do you recommend antibiotic cream for buttonholes after treatment? And if so, which ones?
100% yes. In fact, pivotal. If you are doing buttonhole, again, one cannulator, home setting, absolutely 100% of the times, and Andy and Randy will tell you, I remind them every clinic, are you using the cream? So we have not a lot of studies, but we have very good studies telling us that if we apply antibiotic cream, mupirocin is for the most part what is recommended to the exit site. Once the blood has stopped, you know, you remove the needles, blood bleeding has stopped, you apply the cream every single time, is associated with better outcome, less risk of infection. So what it is different about buttonhole and the robe ladder is that every time, because it is a track that is formed, every time we remove the needles, there's going to be a little scab that is formed at the exit site. You will learn how to clean the exit site very well, how to remove that scab very well without traumatizing the skin. So you will learn different techniques to do so. And then, as very well asked, application of the antibiotic 100% of the times. Yes. Very important.
And just one more follow-up to, are there, how do grafts hold up with the more frequent dialysis? How do they hold up?
They do very well. You know, it's all about the good technique, rope ladder. I want to reinforce that you should not be using buttonhole for grafts. The risk of infection would be much higher. They're not intended for the graft cannulation. As I mentioned, grafts are great accesses. If cared properly with good skills, they can hold a long time.
And I think you mentioned in your presentation, if I remember from the slides, about the access point. Is there a certain access point required for self-cannulation treatments and techniques?
Diane, access, can you repeat the question? Access?
Is there an access point? I saw when you were doing your slides and you were showing the different levels and the with the veins and where the access point that a person has to be able to connect for the technique to actually do self-cannulation. Do you require a certain access point?
Yes, so depending on each fistula is going to be different. It's going to have a different anatomy, so you will learn. You're going to be trained, you know, where to place the needles. The main thing is you will learn, especially if you're doing the robe ladder, which is the rotation of the needles each time. You are going to learn that you cannot put them too close to each other. That's a common mistake even in center. You know, if that's the case and the cannulator is putting the needles too close to each other that can traumatize the vessel over time. So that's part of what you are going to learn about what are the places in your own fistula that is unique and yours that are going to be suitable for your needle placement for each of the needles.
Okay. Thank you again. To our panelists, I know that there is a procedure for education and training for anyone who is considering self-cannulation. Could our panelists talk a little bit and share how you prepared for your journey mentally, physically, the education, if there were required trainings that you had to participate in or your care partners? How did that process work? Rafa, can we start with you? Rafa's, your mic, I think, is muted. Okay, there we go.
Okay. I'm sorry. My wife was fairly new to it. She was just new to everything. Like, so, but of course, she had to. We kind of hit the ground running, and mainly because we used a different machine. We used Tableau by Outset Medical, and so because it was so fairly new, and when we got in there, the staff was being trained and everything. So we really just hit the ground running. And they did that with me because I was already a technician. So it was more overtraining her on how to cannulate. And I mean, once you get to deal with it, it's not really that big of an issue. You're just, all you're doing is just holding the needle, finding your place and putting it in. And if you're just, if you're on your arm, you just find your place, put it in. It's not as big as what everybody makes it out to be in their head. It's more of a mind game than anything. And you know the risk factors and infiltration, hematoma, things like that, sweatal aneurysm. You're like, oh my gosh, all right. Nah, it's really not all that, because it's all going in your mind a million miles a second. Technicians think the same thing, but it is a learning curve as you go. Some clinics have something set up. Other clinics, they may have one person that says try to teach you anything. But all in all, it's very fundamental that people have a foundation. Like, those slides were amazing. I didn't have that. I had my textbook. Like, I have one of my textbooks right here. I have this book here.
Wow.
So it's that's all I have. So if you're a medical provider, please look into that. Please look into getting proper training for your patients, so that way they don't mess up. Because this is something that's not so heavily backed, because not a lot of patients look into it, I should say, rather, because patients really don't want to stick themselves. And that's what I'm finding when I talk to patients as a patient advocate. They don't want anything to do with needles whatsoever. And they don't trust anybody. They don't trust any of their family members or whoever it is the case may be, so they would rather go into the center. But for the most part, it was definitely a learning curve for me. It was a learning curve for me. I'll say that much.
Excellent. Andy or Randy, do you have anything to add to that?
Andy's muted.
I think Andy, you're muted, honey. Thank you.
Okay. There was some virtual training that DaVita provides. Not too many people knew about it. I mean, some of the nurses in center didn't know about it, but it was all online. It was like 6 sessions, 1 session per week. And it was somebody teaching you that, like, how to clean, like the bleach and just everything. And so I went into doing home hemo with a little bit of knowledge, which helped out, but still fear of the unknown. But those nurses, the doctors will guide you through everything. And eventually that fear will go away once you get to know your own vessel. Like Randy said, there's not too many people that I would let stick me. But yeah, it's DaVita home hemo is the way to go. It's in center. But yes, there is a lot of stuff you can do to prepare yourself for home hemo before you go into it, like that virtual session, like I was telling you about.
That's amazing. Dr. Bermudez, if a patient is doing in-center dialysis, and I'm strongly considering transitioning to home dialysis, can you do self-cannulate? Can you do that practice, I guess, in the center to prepare for, building confidence before you transition to home? Or do you just go straight to home and you got to do it?
Absolutely. That's something that's actually how we started. We started the process when the patient was still in center. And I have to share this with nurses and other physicians that are listening. That's actually how we started this. And I love that Randy shared that he saw someone doing it. It's because that was happening in center. And this became an empowering moment for the whole team, if that makes sense. It allows us to learn together, to see how great and empowering this can be. All of our patients that started in center transitioned home once they were able to do the needles. I think, again, I think it's, in my experience as the physician, I think it's the main barrier for patients to go home. Once you are able to do that, I think it's much easier to transition. I think I should a call to my colleague physicians. I have learned from my patients how this is safe. They have been my teachers. They have empowered me to be an advocate for self-cannulation. I also went into it with no experience, with fear, different side of the story, but fear that they would do something wrong. And now I wish everyone put their own needles. I really have become an advocate for it.
Okay. One more thing, Dr. Bermudez. Just real briefly, could you just do a quick refresher for us on the different types of self-cannulation techniques for home
Absolutely.
hemodialysis? Just real quick for us.
So we have rope ladder technique. That would be the only choice if you have a graft. Is the standard of care. Many units utilize this technique in center and at home. For that technique, you utilize the regular sharp needle, and you're going to be rotating your cannulation sites each treatment. It allows for full healing of the vessel, and it's associated with very good outcomes. The buttonhole cannulation or constant site cannulation utilizes rome or blunt needles. It could be very helpful for shorter fistulas that are harder to cannulate rotating sites. It requires a special training, very much related to aseptic technique, which is the cleaning process of those tracks that are formed. That is where the money is. If you follow the technique, if you follow the instructions, we have had great experience in our program with no infections. So it can be very helpful for many patients. Deciding which technique is right for you, in my opinion, it should be a patient-centered decision. What works for one person may not work for the other. You want to work with your team. How is your fistula? What is the length? How is your vision? What is the location of the fistula? Is it easier to access with one technique or the other? And so truly, there's ways we can help our patients choose which technique is going to be the best for them, for all aspects, for less pain, less anxiety, again, patient-centered.
Well, I want to thank all of you for participating today. Dr. Bermudez, your information was just so enlightening. I'm getting ready to make an appointment to take my husband to come see you soon. So I appreciate it. And I wanted to just ask everyone, if the panelists, if you could just share just one thing about how home dialysis has positively impacted the quality of your life. Just one thing from each of you.
I guess I'll go first. It's given me freedom. It's given me control back of my life, and I went from being perfectly healthy to being sick. And, now here I am. While I'm not perfectly healthy, I'm as healthy as I can be. And, I get to do it from the comfort of my own home. I get to watch my big screen TV. So yeah, it's the freedom that I enjoy the most.
So Randy, your word is freedom. Andy, what's yours?
Can I make it 2 words? A blessing.
A blessing. Okay. A blessing, just the whole process. And Rapa?
Excellence.
Excellence, excellence.
It's
Well, I
excellent.
have thoroughly, this has just been amazing. I have thoroughly enjoyed the presentations and the panelists for being so personable, so engaging, just so informative. Thank you all for participating. Thank you all to our participants for the questions and answers. They were amazing. Just want to remind everyone that there is a survey link that will be in the chat. So please, for our participants, look for the survey link. And just thank you all to just take a few minutes just to fill it out and tell us how we did. Your feedback will be very useful as we plan future sessions. Again, thank you for participating. Thank you to our panelists. Have a great afternoon.